All right, you ready for this?
Ready.
Hey everybody, this is Tom Salemi of Device Talks. Welcome back to the Device Talks weekly podcast. So the drop-off went well. Oldest kid is launched at Purdue University, and we are back home after a long, torturous drive. So I wasn't able to put together or conduct a new interview for the podcast this week. I had one scheduled, but frankly, I caught a bug on the way back, and just came home and didn't have it in me. So we'll come back in full force next week. But I did want to share an awesome replay with you that I'll talk about in a moment. But before we get into that, I wanted to let you know that today, Friday, this is August 18th, is the final day you can register for DeviceTalks West under our early bird rate. I've talked about it a lot in almost every podcast episode over the summer. You could save $300 off the price of $695. That's the full price. So it is a significant discount, and it's going up to full price after today. So I advise you, please, if you're going to attend Device Talks West, and I sincerely hope you are, because it's going to be fantastic, please register today and save yourself a boatload of money. You'll be able to cover a hotel room, a nice dinner, a plane ticket, whatever you want with the $300. It's your money. You figure it out. We don't want it. We don't need it. Well, I mean, we could use it, but we want you to keep it. So register today for the early bird rate. But here's a little tip. Because you're a loyal Device Talks Weekly listener and a subscriber, I wanted to give you a couple of extra days. So I asked our great team to build a code just for this weekend. It expires on Sunday at midnight, Monday at midnight, whatever. This weekend, use the code DTW. That stands for Device Talks Weekly, DTW 395. That's DTW 395. Plug that code in when you register, full registration, and you will still get the early bird rate, but only through the end of this weekend. So don't sleep on this, but I'm buying you a couple extra days because I really, 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 really want to see you there. So if someone's not a podcast listener, let them know. It's up to you. This is your thing. You do whatever you want to do with it. So whatever you need to do to get to Device Talks West in Santa Clara, do it. We'd love to see you there. So go to DeviceTalks.com. You can register for Device Talks West. And again, save $300 by registering during the early bird rate. And that's going to expire today for the rest of the world. But for you, you special person, you get to save $300 through the weekend. But don't miss the opportunity, all right? Please, I want to see you in Santa Clara. I'd love to see you in Santa Clara. It's going to be a great 2 days. So please join us there. Go to DeviceTalks.com to register, to check out the agenda, et cetera, et cetera, et cetera. One of our keynotes at the conference is going to be Dave Rosa, the new president of Intuitive. So I thought it would be neat to play one of our keynotes from last year, where I talked to Gary Guthart, the CEO of Intuitive. So Gary Guthart and I talked on the morning of day 2. Dave Rosa and I will be talking on the morning of day 2. Dave's interview will actually be sort of a joint keynote involving our other events that'll be going on at the same time at the Santa Clara Convention Center, robotics event. So it should be a pretty jam-packed event. And I'm eager to follow up on a lot of things with Dave Rosa, including the significance of his recent appointment to the title of president. But I'm giving you the opportunity to hear what Gary Guthart had to say last year, and both you and I can sort of build off that, and we'll direct our questions to Dave based upon what we talked about a bit, at least last year. Obviously, I'll have other questions for Dave as well. But so enjoy this episode with Gary Guthart. We ran this as an Intuitive Talks podcast late last year, but I'm bringing it back for you to whet your appetite, to let you know that this is the kind of quality that we'll have at Device Talks West. I think our audio will be a bit better, and would love to see you there again, October 18th and 19th. If I haven't said this already, October 18th and 19th at the Santa Clara Convention Center. Going to be a great 2 days. If you have any questions about the conference or concerns, email me on LinkedIn. You can find me on LinkedIn, Tom, Salemi, at DeviceTalks. And that's it. No newsmakers this week. I'm going to try to recover from the trip and the cold, and look forward to coming back in full force next week. So thanks for listening, and enjoy this interview with Gary Guthart, the CEO of Intuitive.
I want this conversation to be sort of forward-looking, future-looking, and I'd love to understand, and you described it, the moment you used the Intuitive system for the first time at SRI, you had a vision, or at least you saw where this was going and what this could be. Could you go back to that time and just kind of recount, if you would, the sensations, the feelings you were having when you kind of touched it for the first time?
Yeah, so robotic-assisted surgery predates Intuitive, predates me, and one of the early sites that was doing research, Stanford Research Institute, SRI International, was Phil Green and Ajit Shah, a guy named John Hill, and Joel Jensen. They had built that vision there, started in the late 80s. By the time I joined, I was an applied math type, so I was a technologist, physics undergrad, and an applied math graduate student, and I joined. And this was 93. They had a prototype working, and it was kind of an open surgery thing. Had 2 cameras and was not endoscopic at this time. It was an open surgery telerobot. And they were interested in getting somebody to help with some of the math. That's where I came in. I got to sit down and try it, and they gave me a task to do manually. They gave me a couple of Castro Viejos, a couple of these grips, and tiny suture and very small, thin tubes to anastomose together, to suture together with a set of loops, handheld loops. And I'm a technology person, so I fooled around with stuff in my garage. I was constantly taking things apart and putting them together, so I felt like I had some assembly skill. And it was really hard, with this loops. I could do it, but wow, is it hard. They said, okay, set that down and come sit over here in this thing. And it looked like it was right out of a sci-fi movie. The wires hanging out everywhere. It was a prototype. The computer was a cabinet the size of the lectern. It was big. And but I just loved it. And they said, now try this. And it had tremor filtration. It had high dexterity instrumentation. It had really good magnification, 3D magnification, 3D system. And this is, 93, and it was a good 3D system.
Wow.
And so sitting there doing it, it was like, well, this is a ton easier to do. It was really impressive. And it was one of those moments where you sort of, a demo's worth 1,000 words, and everybody in the audience knows that. I think you can talk and talk and talk. You can send people scientific abstracts. You can show PowerPoint slides. But if you can try it, it makes a difference. And I tried it. I stood up from that and I went, wow, this is awesome. If this can work, if we can really do that, then it will change the face of what people do. And I went over to my boss at SRI at the time and said, can I transfer into that group? And I had this guy named Raul Martinez. Raul said, all right, finish up your work and I'll get you transferred into this other group. So he was a good boss, and off I went. So it was fantastic.
But if I recall, you needed some convincing to join Intuitive proper to go to the corporate side. What was holding you back?
Intuitive was founded by folks that I had not met. There were 3 founders to Intuitive in late 1995. Mm-hmm. Fred Mall, a surgeon, Rob Young, a technologist, and John Freund on the financing side. They came over to SRI, licensed the technology, and I met them as a young engineer in my 20s. And they invited me to join. Rob did. Rob called me up and said, why don't you come over? And I had just gotten a promotion at SRI. I was kind of in the heart of my technical career. And I felt like I was going fine. And I wasn't sure. I wasn't sure what to make of all of this stuff. I wasn't deeply immersed in Silicon Valley culture. Mm-hmm. And it talked about things like stock options, and I didn't know what that was. I had to phone a friend. What is this thing? And so I said no. And the first time I said no, and they called back and said, we think you ought to reconsider the kinds of things you're doing. We think we called it at Intuitive. We called it being a systems analyst, kind of a control systems engineer. We think we could use you. We think you'd be good. And so I took a second meeting. I talked to my wife, and she was like, hey, we're young. We had a 1-year-old daughter. Now's the time to take a risk. Don't. Bigger risk is better earlier. That was her advice. Mm-hmm. And I talked to John Freund. He took me out to coffee, and the way he convinced me is he said, hey, the applied research market will always be there. There will always be a need for that. Why don't you see what it takes to actually translate the technology from the lab into actual use? Why don't you have that experience? If it goes great, great. Mm-hmm. And if it doesn't go great, you'll be a more valuable applied researcher because you'll know what it takes to do the translation. And I was like, that's absolutely true. I should have had that thought. He's absolutely right. So after that, I said yes. And wow, am I glad he called me back.
Yeah, no kidding.
It worked out well.
I'm sure there's lessons about stock options helped as well, too.
Yeah, and they helped me I learned what stock options were. That's true.
That's great. So let's talk about where we're going to sort of fast forward 20 years or so to where we are today and look a little bit about the path that got you here. Give us a sense of Intuitive's reach today globally in the U.S. and how deeply have you penetrated the market for surgical robotics? The company's been here for a time. You would think that now you may have not reached a saturation point, but you would have there would have been a deep penetration in the surgical robotics market. But I'm always shocked at how much larger the market is than the market you have at the moment.
Yeah, it's big, maybe bigger than you think. Kind of zooming out, in the United States, if you just ask, these numbers are approximate, so don't get too attached. But at the top level, if you ask, how many surgeries are there a year where you need general anesthesia? Just sort of start there. The numbers, give or take, 21 million a year in the United States annually that are general anesthesia. And then you say of that, there are a bunch of different segments, many of which we don't participate in. So there's orthopedics, knees, hips, spine, there's cranial, there's eyes, laser eye surgery, other things. We don't participate in those. So if you kind of narrow down to the ones we do participate in, there are about 7 million a year, give or take. And if you go through and you say, well, how many did you do last year? Globally, Intuitive surgeons using our platform performed, I think, 1.3 million, give or take, last year on a base that's give or take 5, 6, 7 as a reasonable number that is accessible to the existing Da Vinci platform. So relative to just what we think we can do with the Da Vinci platform in global markets, maybe a quarter penetrated on a per procedure basis. That doesn't count things like flexible robotics, which is our Ion platform. It doesn't count where we want to go with new indications that we're working on, additional ways to reach the body. So I think this idea of computer-assisted surgery is still really nascent. It's been around for 20 years. It's still nascent. And there are plenty of companies. There are several companies doing work on robotic assistance in hips, knees, joints, shoulders, spine. There are others that are using similar concepts for ablative techniques and ablative technologies. I'm sure we'll talk about that. So I think there's decades worth of additional opportunity. I think we're still what amounts to the early market.
So let's talk about and I do want to get into Ion, and you're very kind to schedule your analyst call the day before the meeting. So
we tried to arrange that for you.
It was really awesome. Thank you. It helps. So You're I think the best case for a first mover into a space. I mean, you're as you mentioned, there have been others who have moved into surgical robotics, but it's interesting. Whenever I interview any other surgical robotic company, your name comes up, not only specifically, but when they're trying to describe their product, because they say their product is, then they pause and they go, Intuitive. It's like they can't help but give you a plug. So you've been a first mover for a long time, but the competition, as you mentioned, is coming. How do you view, as someone who holds so much of that territory, do you view that as competition? Do you view that as some power some tailwind that's going to push you along? What is your sort of view of the others who are coming into the space? Yeah,
let me touch on one thing about first movers, and then I'll come around to how do we think about as the space becomes more crowded. There's a FDA-cleared surgical telepresence system before us. It was the Zeus system from Computer Motion down in Santa Barbara, and the founder and CEO, Yulin Wang, has become over time a friend and colleague. So the concept has been out there. We actually were not literally the first to have a cleared product, but ours met customer need. And the early concept of the Zeus was roboticizing laparoscopy. The idea was, hey, we're going to make laparoscopy and the whole user interface feeling of laparoscopy mechanized. We're going to put robots in there and that'll help. And we had a different idea. So it was actually similar technology, but a different use case. And in our world, our concept was, hey, we want to return to surgeons the feeling of open surgery and retain the benefits of minimally invasive surgery for the patient. So it actually gets to a point that will be interesting when we talk about competition, is technology is out there available to anybody, and many of you are providers of that technology. So we all go shopping at the same place. We all have the same kind of basic ideas about where base technology is. But how you assemble it and what you try to do, what your goal set is, differs. Okay, competition, I think in three broad categories, and they are always there. The first broad category is actually at the patient-centric level. A patient is diagnosed with the disease and starts the journey to understand what the treatment options are, of which surgery is one often. Surgery is often, in the case of many cancers, both the most effective and the lowest cost and the highest likelihood of cure. So surgery becomes a good option for a lot of people if things are caught early. So we're competing with immunotherapies, we're competing with external beam radiation, companies like Varian and Electa, we're competing with watchful waiting, we're competing with all sorts of other things that people can do. I actually think that is the most important form of clinical and economic competition. I'm going to come back to that. The second part is, hey, there are other people who have concepts and ideas in robotics that are similar to ours. And so they put out a system that has a little bit different configuration of the robots, or it has a little bit different way it interacts with the surgeon, but essentially it's the same idea. That's kind of a head-to-head. We have a pickup truck, they have a pickup truck. Who wants to buy which pickup truck? Okay, there's that kind of competition. I think that's what you're asking. There's a third kind, which is somebody who comes along and says, hey, I'm going to use a different architecture altogether. You're using these big robots, and they have these instruments that snap on, and I want to use a mechanized snake and go after it with a mechanized snake. It's three different things. I care a lot about the first one, that we want to make sure that we are competitive from the point of view of clinical outcomes for a patient undergoing disease. We feel like if we can invest there, which means how do we do about outcomes in surgery? How do we do with changing the outcome bar, raising the bar? We think that is positioning us really well for the long term. We don't ignore the one in the middle, which is those companies that are saying, hey, I'm going to make an intuitive-like system, but I'm going to change this technical feature or that technical feature. We pay attention to that, but I don't lose a ton of sleep over that. I think those are design choices. We have fantastic designers. So those are kind of easy to understand. And then the third category, those are great opportunities for us either to innovate ourselves, ION is such an example, or they're great collaboration partners. There are opportunities that come up on new architectures we think are really interesting. That was a long answer.
No, it's interesting. I mean, the first group then, what are your objectives with that first group? It's merely, not really, the intention is to make sure your devices perform best and perform those procedures with the best outcomes. You're just looking at it as a medical device company.
I'll ask, can I ask the audience a question now?
Sure.
Just ask the question, how many folks have had a surgery of some sort? You're willing to raise your hand? Yeah. Any Da Vinci patients in the room? None.
Wow.
If you look at prostate cancer surgery, so gland in the man, in the pelvis, high frequency of cancer, if you choose to take it out surgically, the positive surgical margin rate, meaning the likelihood that the surgeon, when they're dissecting it, leaves some cancer behind because they cut the cancer, that rate varies between 20 and 30%. So somewhere between 1 in 5 and 1 in 3 men will have residual cancer left behind. And it's because you can't see the cancer with your naked eye, but you can light it up. And so we've found, working with academic partners, molecules that will bind to the cancer tissue. We attach a fluorophore to that molecule and then image it using fluorescence imaging. And as a result, the surgeon can see in real time, not ex post facto, hey, I left some cancer behind, I'm going to continue the resection. It's real-time pathology during the case. We think that will drop the positive surgical margin rate significantly. You can ask, well, what's the negative consequence of positive surgical margin? Is it immediately cancer recurrence? The answer is not really. But what will happen is if you find additional cancer, you may have biochemical recurrence, you may have it come back, or you may have to go get adjuvant therapy, which means you get radiation in addition to surgery. So these things are hugely powerful. And you say, okay, but the people who are working on the radiation machines, and God bless them, thank goodness there are radiation technologies out there, I think they're important, they're working on their advances. So what happens in radiation, if you have imprecise targeting, you wind up damaging healthy tissue. That healthy tissue can create nerve damage, it creates urinary incontinence, and fecal incontinence can create other things. Radiation starts to degrade over time. So if you radiate something, it tends to be healthiest right after the radiation, and then over time those tissues will degrade, such that years later it's hard. So that is core treatment level competition. And we want to make sure that we can do things that continue to be innovative there and change the outcomes. And we're not chasing 1 or 2% complication rates. If I could share with you the clinical data on all these common conditions, you would be shocked at what the level of complication rates are. Not specific to Da Vinci, but open surgery, laparoscopy, Da Vinci surgery. So there's an enormous opportunity for core, serious value creation. So our saying inside the company is we really want to innovate what's happening inside the tissue. We really want to innovate what's happening inside the body, because that is core value creation. We will attend to competition that is feature-based competition. We understand that comes down to good design, and we will look for new opportunities and new platforms and partner them where we can.
And does focusing on that first group change your nature? Because again, it sounds like you're a medical device company. You're not a robotics company. You're really looking at the points that touch the body more than the arms or whatever moves the system.
We are experts in robotics, but we don't define ourselves as a robotics company. And I think we're going to talk a little later about what could this all look like 20 years from now, 30 years from now, and all these designations of what's robotic and what's medical device, all those lines will blur. They're blurring now.
Interesting.
In a sense, it doesn't matter. It's going to be how do you assemble a really good technology ecosystem to get a good outcome, whether you call it a robot or not. But anyway.
Yeah, oh, that's great. Well, let's talk about Ion now, because you did have some great news last night in your analyst call, and maybe you can give us an update on the units that you've moved. You had a strong quarter there, and we did a podcast with Charlie Dean and Oliver Wagner about Ion, and it was one of those moments where just hearing them describe having a robot system that's small enough and that's nimble enough to get into the very distant edges of the lungs to both diagnose and potentially to treat. We'll get into that. It was one of those light bulb moments. You're like, oh my God, that makes all. It's not helping a surgeon do something they're doing and helping them doing something better. You're actually blazing new territory. So I'm stealing your thunder, but tell us about your quarter with Ion, because it was very strong, and tell us a bit about the Ion program and where it's headed, because your news did include something that I don't think I was aware of about the ablation. Yeah,
just 2 seconds on what is it. Our Ion product is computer-controlled, robotic back-end, robotically assisted, steerable, flexible catheter. The catheter is about 1 meter long. It has fiber optic sensing all the way through it, so we have something called shape sensing, which means that we know not only where the tip is, but we know where the body of the catheter is everywhere in between both sides. It has a through lumen in it. We do a preoperative scan of the chest. We get a 3D map of a patient's individual lungs, so we create Apple maps for that patient's lungs. And then we help the surgeon or interventional pulmonologist navigate that instrumented catheter deep into the lungs to go sample tissue. Lung cancer, high incident rate, it's usually number 2 or number 3 in the country, depending where you are. Lung cancer is typically the highest mortality rate of the cancers. So it's not always the highest incident, it is usually the highest mortality rate. Finding those samples early, finding definitive diagnostic early matters. Most early detected lesions are in the periphery of the lung. They're not near the main bronchial channel. That means is it's hard to go get the tissue. It's hard to figure out where it is. And there have been various technologies and approaches to get that. We do it transorally. So you go through the mouth into the lungs, use this preoperative map, drive your catheter using your preoperative map, sample it a bit of that lung tissue come back. That's what Ion does today. There's some hard technical issues there. There's some interesting clinical workflow challenges, but anyway, we work through those things. We started a prospective trial called the PRECISE trial. Interim data started to look really good on that. Later data, I think, was just published this week at CHEST. At the CHEST, it was just announced. The final data on that looks as good as the interim data looked, and that's been, I think, underpinning nice uptick in the marketplace. So we're still in the early market. I think the total install base of Ion systems in the United States is between 100 and 200. That will be early. But utilization continues to increase, so they're using it a lot. And both install base is growing and the procedures per system installed are growing. So it's being quite productive. I think that pulmonologists are finding it's doing what we had hoped for. It's competitive. There are other technologies in the market that are guided but manual, so they use a map, but they don't use a robot. There are other technologies that are out there that are both robotic and guided. And so far, the performance of ours, its workflow, kind of the total ecosystem that surrounds that product has been strong, and that's driven our growth.
So do you see that Ion being a model of where you're headed, and will that become will these systems that are going after areas that Da Vinci aren't, will that be a larger part of your business, or in the future do you see Da Vinci always being sort of the flagship product and these others being part of the fleet?
Time will tell. I don't know. I think in the near term, opportunity for Da Vinci multi-port soft tissue surgery is quite strong. And as I said before, I think we're somewhere between a fifth and a quarter penetrated in the opportunity we have. So there's clearly opportunity there. The flexible technologies, you can think about navigating tubular structures in the body and being able to pick up tissues, to sense the tissues, so you can have in onboard sensing, or you can drop off or interventional methods with those technologies. And that's the conversation about ablation is, okay, if I can navigate somewhere with very high precision, if I can deliver packages and take them out, what is it that I can do for a physician and a patient? And that opens real opportunity in the lung for sure, and that's our first application area, and we're quite focused on it. But it'll open opportunity in other tubular structures outside the lung as well. And I think over time that opportunity will grow.
How is your relationship with customers, with hospitals, with physicians? How is that changing? I think in the call yesterday, you suggested that you saw some movement in workforce issues, that the hospitals were having an easier time, but it's a difficult time for the healthcare system overall. How are you working with them to help them see the value in what you're doing and what you're providing, and ensuring that they're able to get it?
Yeah, one of the important things for us, and one of the things we've really focused on in the last 6-7 years, has been hospitals, particularly administrators, don't care about robots at all. That is not.
They don't care, or they don't like them?
Well, a decade ago, I'd say they didn't like them. I don't think that's where they are now. I actually think they see the value in them now. But I think it's a means to an end. So start with the end in mind, right? What's the end? What are they looking for? They want to be able to treat their patient population with great outcomes. They want to attract, retain, and develop the best of the physician staff that they can. And they need to manage their cost per intervention. They got to manage the economics, both the revenue side and the cost side, of whatever interventions they provide. And so we start there. So it isn't really a question of robot versus robot. It's, can you deliver a full program or not? Can you demonstrate to them true value of that full program? So the program is something they define, it's their words, the quadruple aim: better outcomes, better care team experience, better patient experience, lower total costs per episode of care. And we measure that. We've actually built a program that allows us to do collaborative work with them and their electronic medical records to be able to demonstrate that value as it compares to open surgery or laparoscopy or robotics. And in that setting, I think they look at it quite positively because it's data-driven, and it's not data-driven on a white paper. It's data-driven based on their own data sets and their own dashboards. So I think that's been a really strong supporter for total value around a robotics program. It's really changed the conversation. And I think as we look at complex dynamics like staffing, There are some hospitals that are in a really defensive position. There's been a nursing shortage or skilled nursing staffing shortage before the pandemic, was exacerbated by retirements in the pandemic. If a hospital is in a really defensive position, they're having a hard time actually providing the first line care. Mm-hmm. If that's the case, then they've got to solve that problem. Often they solve that problem by paying higher wages. So there's wage inflation, and that has helped them solve the first line care problem, which is I can give you the procedure. But then they have a follow-on care problem after the procedure. And that is you have to care for patients in the rooms, you've got to follow them up. Surgeons and doctors have to round on that set of patients. High quality, minimally invasive surgery discharges patients sooner. They have fewer complications, they take fewer drugs, they're less likely to have a serious issue, for example, in the ICU. So if they can do the cases, it is highly efficacious for them to do high quality MIS versus open surgery or less predictable lab. And we're very strong for them in that regard. So that saves them downstream costs. It relieves downstream staffing pressures. Does that make sense?
Yeah.
If you can do the surgery, we save nursing expenses after the surgery.
So how much more are you committing to data? That was one area that I completely overlooked when I first started talking to your team. And I talked to a few folks about the data collection, gathering, analysis that you're providing. How essential part of that? It's obviously an essential part of your business. Is it a growing part of your business? And is it one that's going to continue to grow?
I think for many of us, it's an interesting data has always been a part of certainly any automation, robotics, telepresence system. You're going to have both interest in data and access to it from the very beginning. So in some sense, we talk about Intuitive as being born digital. You have to do it and track it. We have access to an opportunity to evaluate a lot of data now. If hospitals are willing to share electronic medical record data, we can connect, think of it as federated data, we can connect electronic medical record data with the data from the actual surgery to the follow-up data. It's anonymized, it's cyber secure, you need to take care of all those things, but you can start looking for patterns or for correlations between patient preoperative condition, surgeon and care team behaviors, and then outcome in the end. Those things are crazy powerful,
sure.
Super powerful. So we're investing in that. We care about it. We have many data partnerships with our customers to do that, and those efforts are bearing fruit. They're producing insights that are actionable by our customer base. Getting the economics right isn't always trivial. It's a little bit easier to say it than it is to do it, and we're working through that. But I think it will be value creating for hospitals. I think it will be value creating for Intuitive over time. But it takes a little bit of effort and infrastructure to get in there.
What might that effort look like in a couple of years? Is this something that you could pull out as almost a consulting arm or something, or will the data you provide always be connected to what Intuitive can and cannot deliver?
It's a good question. Where we are today is we will provide, we already do, provide a significant amount of data insight for any of our customers without additional charge. Mm-hmm. So just by working with us, we will help them see the basics of their programs. There are some things that we can do that either allow them to do additional research, of which they are interested because they have a research mission, or can generate additional follow-on benefits for them, in which case we'll charge them a consulting fee or other fee for it. In general, those things are relatively small. A lot of the core value is just built into the platform.
Mm-hmm. Fascinating. I almost hesitated not to ask this, but I'll ask about supply chain disruptions. How has supply chain hit you? Has it impeded your production at all? Has it kept you from shipping?
How many folks in the room are supply chain related one way or another? Yeah, the way we talk about it is a Western bar fight that goes on day after day without end. It's hard. It has not been trivial. If somebody else in the audience has a better description, I'll hear it. I'm open to it. But I would say, a typical Da Vinci system has about 10,000 components.
Wow.
Single device, 10,000 components. And of those, they're everything from things straight out of somebody's catalog, it's a pretty standard device, all the way up to custom machined or molded parts that are sourced from a lot of places in the world, some of whom may be in the room. And so you see challenges in the things you read about, semiconductor manufacturing and semiconductors. You see challenges in raw material supply, plastics and and some of the other things that you need. Our team had done a nice job early on building safety stocks ahead of a problem. So, the best time to plant a fruit tree was 30 years ago. The second best time is today. Some of our folks had planted quite ahead of time. That gave us a little bit of time and flexibility. So I'm thankful to our operations leadership who had anticipated. Having said that, that only lasts you so long, and then you have to respond. And we have been responding every single day to shortages. And one way to do it is to call through and see if you can find shortages in the supply chain somewhere. Another way to do it is to switch to parts that are available from parts that are not, and qualify new parts. Those are kind of your big choices. The other one is that you have substitutes available on hand that you've already pre-qualified, and we wind up doing all three. Mm-hmm. I don't think, from our perspective, the breadth of raw materials and components that are challenged has started to narrow. But it's not zero, and it's certainly not back to pre-pandemic levels. So it's the peak is behind us, but it's not something that we'd say is finished and we're done. And our safety stocks are not all the way back up to full level. We're starting to rebuild them.
How does your supplier list look today compared to 2019? Did you go? I've seen two strategies. We'll add 10 more to each product, or we're only going to 2 or 3, and these are our folks, and we're going to give them the business they need, and they're on call.
Yeah, we were interesting. Intuitive is really kind of 3 businesses under one umbrella. There's a robotics business, which is in the world of manufacturing, low volume, very high precision. There, you want to be careful about spreading into 1 million suppliers. Mm-hmm. We'd rather work very closely with suppliers who understand our needs and invest alongside them. You'll never get to huge volumes that will make you a big player relative to somebody who's making cell phones.
Gotcha.
And you're much better off being close. We have an instrumentation and accessories business, the things that are used in every case that are much more high volume, more plastics, and those are built at millions a year. And those things, you want to work with companies that have the volume and scale that can flex with you. Again, I don't think you want to spread it across the universe. And then there's what I think of as commodity supply, things that are catalog based in there. You'd use the different strategies. It's not really a one size fits all.
Interesting. Okay. We've got about 5 minutes. I would love to get we started this conversation about your experience 30 years ago, I guess. I was going to say 20 years ago, but let's shorten the time to 20 years ago. We're at a point today where at Mass Device and MDO, we're writing about all different robotics companies. There's more than we can literally keep track of. And as we do our list of everything you need to know, we find out there's more we need to know about the robotic startups. So I don't know where this ultimately ends up. They're certainly not all competing technologies with each other, or certainly with you. But what is this digital surgery or robotic surgery system look like 20 years from now? Is it all these different components owned by 2 or 3 entities? What does the surgical suite look like? How are you looking at the future when you're CEO 20 years from now?
Yeah, well, zoom out maybe a little bit. I don't think we'll be talking about robotic-assisted surgery or robotic-assisted intervention as something different than products. It won't be a subcategory. Mm-hmm. I think it will be. There won't be a subsection of a group. This is the way things are done. I think you think about advanced imaging, cloud computing, mechatronic assistance, and in the workflows and human factors engineering that goes into that. I think it'll be built into healthcare, period. It will be so ubiquitous, it will not be commented upon. And when you're talking about DeviceTalks, it will be the rare one that does not have an intelligence component to it, not the other way. So I think that trend is already well underway, and it's inexorable. And as a result, I think there'll be a vibrant ecosystem of entrepreneurs and small companies and large companies and consolidators who are working within that space. And I think you're seeing the big consolidators realize that and pivot to it. Mm-hmm. It just reminds me a lot of electrification in automobiles. There's a point at which it's not an electric car, it's just a car. And it's a propulsion system in a car, and that's what people are doing. And I think we're not so far from that. I think the same will happen in our space. as to intuitive and what that looks like, I don't walk around thinking about us as a robotics company. What I think is we have a really good organization that can identify less than optimal clinical outcomes. We have a clinical team, and they work closely with our customers to say where the outcome's just not very good. And then we have a bunch of designers, engineers, architects who can go through and say, how do we build a technology-enabled ecosystem that can substantially change that set of outcomes? Notice there's nothing in there that says robot. It's just a set of technologies. And then we have an organization that I think that can realize that through manufacturing and deploy it in the field through commercial and training resources. And in the end, we try to support that with the data analytics and cloud architecture. That is our internal concept, our architectural concept for the company. Mm-hmm. I think that's a durable concept. And as things like molecules come online, can we integrate them? So if you think of us as hardware plus optics plus software plus electronics, we started to add molecules, which is kind of wetware. But it flows well in that total concept of a technology-enabled ecosystem that can deliver an outcome. So it's not hard for us to get our heads around. I think several companies will start to build that throughput, that idea.
By adding molecules, you mean adding?
For example, contrast agents that can be used during surgery. That's what I meant on molecules.
Okay.
Sorry about that.
No, that's I wasn't sure if that's where you're going. But so, and wrapping up, but just last question. We do see a whole, as I mentioned, a group of startups out there. Do most of those go away? Are there technologies that absorbed? What do you see happening to this crowd of surgical robotics startups? Yeah,
it's interesting. I think, I'll just speak to the past as predictive of the future. It can be done. There are, if you went back, if we were sitting here 20 years ago, there were about, between then and now, about 25 commercial groups that had made serious attempts to deliver their robot systems to the market. Mm-hmm. Of those 25, 5 are in the market existing today, remain. And 20 were either absorbed or assets were sold or whatever. So I think it's Intuitive is one of the 5 that's standing, but there are several others. There's now 150 or 200 that are looking at robotic platforms of one sort or another. And the odds ratio is probably about the same. Yeah. You can do it. It's hard to be there and freestanding, but that's set of odds is probably not so different from tech startup or the next generation semiconductor chip or whatever. So it's doable, but it's not trivial.
Fantastic. Great. Well, thank you so much for the time and the thoughts.
Thank you.
Appreciate it.
All right, well, that is a wrap. Thanks so much for listening to this episode of the DeviceTalks Weekly Podcast. I hope you enjoyed that replay of my interview with Gary Guthart of Intuitive, and I really, really hope you'll join us at DeviceTalks West. We've got a lot of great other keynotes other than Dave Rosa of Intuitive. We'll be speaking with Fred Khosravi of Imperative Care. We'll be talking with Julie Tyler of Abbott, head of Abbott's vascular program. And if you like surgical robotics, we'll end the event with a keynote interview I'll do with Hani Abuhala. He's company group chairman of robotics and digital surgery at Johnson & Johnson MedTech. We'll have lots of other great surgical companies there as well, robotic surgical companies, vascular companies, neuromodulation companies, diabetes companies. We'll be covering a whole range of medtech companies, and you should just be there. So make sure you attend and make sure you use the special code. If you don't get it done, if you don't register by the end of the day today, over the weekend, you can use the code DTW395, and you'll get that early bird rate, that $300 rate, $300 savings through the weekend. But then it expires on Monday, and that's it. I can't help you. I'll have nothing for you. So please join us, DeviceTalks West, October 18th and 19th at the Santa Clara Convention Center. Thanks, everybody. Have a great weekend.